We are seeing chronic ailments rising like an epidemic, especially in the wake of the pandemic. Almost every household has someone suffering from some chronic ailment. Call it anxiety, call it depression, insomnia, chronic fatigue. 6 out of 10 Americans are suffering from a chronic disease. And we don't have enough resources. Modern medicine has made astounding progress with groundbreaking treatments and new drugs. But when it comes to chronic disease, it leaves us yearning for more. Patients are frustrated. Patients are finding themselves dependent on medications. Side effects of medications just gives them more pills. Is there more we can do? Is there something else, perhaps, which we are missing? All we are doing is trying to manage the symptoms. All we are doing is trying to quieten down those voices in the head, which is making a person feel restless, anxious, depressed, or is making him or her lose the sleep. And these thoughts, anxiety, it just does not stop in the mind. These emotions, like energetic wire, it is connected to the physical body. And as unknowingly we keep on suppressing these emotions, these energies are contributing to make the body feel the dis-ease. There are so many chronic diseases which are like an epidemic of its own. IBS, gastritis, reflux disorder, hypertension, diabetes, heart disease. Our doctors, nurses, healthcare workers, all these people have worked so hard, especially during the pandemic. They have put their lives at stake to save other lives. And it is amazing how modern medicine has made these advancements in treatment, surgery, prescriptions, that we are able to treat those ailments which were untreatable a few decades ago. But at the same time, we cannot deny that the chronic ailment is still leaving us frustrated. Doctors are frustrated, healthcare workers are frustrated, because we are only able to treat symptoms. I am one of those frustrated doctors. I am Sonia, and I am a doctor who has turned into a healer almost nearly a decade ago. I was feeling frustrated writing prescriptions. Somewhere there was a void within me. Somewhere there was restlessness within me, that I am not actually helping the patients to the fullest. I am just making them dependent on prescriptions, even though medications were making them feel better. But they were asking me again and again, is there anything more which can make me feel better? And then things were happening in my own life, which made me think outside the box, which made me think that perhaps there is a missing link which we are completely ignoring. And it all started from home, from my own family. My mom is a cancer survivor. Like a tigress, she fought cancer twice and came out of it as a winner, a survivor. But then she went into major depression, and that depression made her have suicidal thoughts. I was not with her at that time. I was in Dubai and she was in India, and I was feeling that frustration. I didn't know how else to help her out. She was on medications and I was trusting the medications. till that day when my dad called me and told me that she jumped off from the 5th floor of our building. She survived. She survived. But then her face really got disfigured, and despite doing so many plastic surgeries, we just could not bring back that beautiful smile she always had. And looking at her face, I felt like a failure. A failure as a doctor, as a daughter. And I felt I could have done more. Definitely I could have done more, but what could I have done? I just know prescriptions, and she was taking medications. But still that happened. And that traumatic event pushed me to think outside the box. What are we missing? What can we do more for our patients? What does the world need right now? And it was so clear to me that in medical school, we are taught to treat disease by handling the physical body. But unfortunately, the mind is never addressed. Like me, I know there are so many others in the medical field who have that frustration. And that is when the science of mind, hypnotherapy, happened to me. And as that journey began, I was feeling so excited, and I felt, wow, why was I not taught this before? Why was I not told as a doctor that our emotions are so strong that it can actually make the body diseased? I just didn't know that. As doctors, we are taught to hide our emotions. As doctors, we are taught to tell our patients, be strong, do not cry, do not fear. But then that fear is legitimate. That sadness which the patient is going through is legitimate, but we just don't know how to handle it. And this modality, this beautiful science, taught me all of that, how our emotions as energies keep on vibrating in the physical body, and then the body just cannot take it anymore, and it goes in a state of dis-ease. And that was a huge thing for me as a physician, as a doctor. And I started integrating what I learned into my practice. And wow, magical shifts started to happen. My patients were actually feeling better. Some of them became prescription free, and the others were dependent as a maintenance on medications. And they were thankful, they were happy that there were no side effects of these medications in the body. The quality of life started to improve. And that is what turned the doctor into a healer. We have to treat the mind and the body together. And hypnosis is that bridge. Through the power of mind, we can make the body feel better. And having worked with almost 2,000 cases, seeing those amazing results, it has given me that purpose, that desire, that mission that I want to bring this awareness, this beautiful resource we humans have, our mind, the power of our mind. To understand it, to use it to heal the body is the modality which I have taken over now, and I have let go of my stethoscope. I do not need it anymore. I treat my patients through the power of mind. I help my patients to feel empowered from within. I want this awareness now in the medical field, in the general population, that we have a resource. We have a resource within us. Instead of handling chronic ailments just by treating the symptoms, is there anything else we can do? I have found the solution. After working with thousands of patients, understanding that our thoughts can actually contribute to the disease, it is time for us to connect the mind with the body to heal the body. And I call this protocol mind-body hypnosis. And it has worked wonders. And through this protocol, I have worked on so many patients suffering from different chronic ailments: gut issue, insomnia, migraine, pain, anxiety, depression. It is that ray of hope we all need right now. There is more we can do. It is time to have that paradigm shift in the way we practice medicine. It's time to connect the mind with the body and heal the body through the power of mind. It is now my mission, my purpose to bring it out to the world. And of course, this is not a one person's mission. I need my people, my tribe next to me. People who are passionate as myself to help others, to heal others, and there are so many out there. And perhaps there are financial situations which are making them unable to get themselves trained or acquire new skills, new tools. I would like to offer scholarships to those willing, those people who are ready to bring a message, a solution out to the world and train them in this modality. I call that creating transformation agents. These transformation agents, having understood, having learned the protocol, getting certified in the modality, are going to reach out to the world to offer a solution through telehealth platform. I think technology is such a blessing. Literally sitting at home, you can connect to people anywhere in the world. You can actually give hope to thousands of people out there. So this telehealth platform with the transformation agents is going to be the ray of hope I want to bring about to the world. And of course, making these services, making this beautiful modality, the solution available to people who can perhaps not afford alternative treatment. Perhaps they belong to low socioeconomic background. I want to reach out to them. Collaborating with hospitals, reaching out to a population who is willing to take this on, who is willing to feel not only empowered, but is willing to once again heal the body through the power of mind. And perhaps from there, more and more research is going to get established into the field. The more work we do, the more we polish the protocol, the better solutions we bring out for the world. And last but not the least, the bigger vision is to bring mind medicine clinics everywhere. Everywhere. It's time we practice medicine differently. Mind component has to be included in medical practice. And that is what my mission is all about. Let's begin this mind medicine movement together. Join hands with me. If you believe in this, hold hands with me, support me, and let's move together to bring this paradigm shift in the way we practice medicine. The bigger vision. When a person feels healthy in mind and body, this is perhaps a happy individual. A happy individual takes care of a happy family, joyful relationships, joyful work environment, joyful community, society, and a much more happier country. Just imagine, we can all do that, we can all achieve that by working on the mind. And this bigger vision is what I want to bring about with your help. Join hands with me. If you see what I am seeing, it is possible. Our mind can be our biggest friend. It is our biggest resource. And this handling of chronic ailments through the power of mind is not only going to create happier families, happier society, happier communities, but how much of the economic burden it is going to take care of. We can use those financial resources in so many other ways. Let's tap on the resource we all have within us. Join me in this mind medicine movement.